this past year experienced in the Twin Cities here an inversion event. Now this is not an unprecedented event by any means, but it is predicted that the changes that are predicted in air quality across the United States would include more types of stagnant air events, so that we would be seeing increases in pollution. Now among the health impact of that is, of course, if we look at asthma, persons suffering from asthma, and most especially children who spend a good portion of their day outside, will be impacted by that lower quality air. Another impact of the changes in air quality due to climate change is an increase, according to the Centers for Disease Control, in airborne allergens. And we know, of course, that people who suffer from airborne allergies would then be impacted quite negatively by an increase of that kind.
Now, why would allergens increase in the air?
That specific aspect of climate science is not an area that I've done any deep work in, so I can't tell you exactly. However, that does come from a very reliable source, Howard Frumpkin at the Centers of Disease Control, who is the head of their Environmental Health Sciences Division.
I would suspect that as we get a little bit warmer, more things will grow, and as we have more growth, it'll leave off some of the pollens, things that are changing over the years. And then the whole stagnation of air, is that because we don't have the currents or the changing currents, or because one of the things is we have more storms, more frequent storms, more severe storms? Why are we going to get the stagnant air?
Well, again, Ed, I'm struggling myself to come to grips with the enormous breadth of this public health issue. And to a large extent, that's a question that a climatologist would need to answer for you. Where I've tried to focus my energy at this point is looking at the climatological evidence and looking at what our best sources of information have predicted will happen in our atmosphere, and then to look at what the health impact of that is likely to be.
What about water? So you got air, you got increased allergens and stagnant air with pollutants. What about water, which is another big component?
Absolutely, and perhaps one of the very biggest. Ultimately, air is a more immediate impactor of health at some level than water over time, but water is such a powerful influence upon our health in so many different ways that will inevitably be a pathway by which climate change impacts public health. We've known now for decades that there is a process of desertification occurring across the world. That has many causes, of course, including land overuse and soil depletion, but some of it is due to increased temperatures as well. As this occurs, we'll see certain regions having greater and greater difficulty accessing both clean and potable water. For communities that have significant access to economic resources, they should be able to deal with this in most cases. However, the price will go up. Where the real concern comes in from a public health standpoint is among those persons with already marginal access to sufficient water supply and sufficiently clean water, because that access will continue to be restricted for those individuals.
I think just more recently when we've had the typhoon in Myanmar, and from what I understand, the storm surge came and flooded a lot of the rice fields, because you were talking about the cost of rice and that it was related to certain tropical or environmental events, and that not only affected their water, but you now have the rice in salt water, which is sort of incompatible. Is this the kind of thing that we'll be seeing around the world?
It is possible. I don't dare to make predictions about the frequency of such storms like that or Hurricane Katrina. There's certainly been a debate raging the past years since 2005 about whether or not Katrina could be partially or largely attributable to climate change. And I think, again, the only way we're going to know that type of thing for certain is over time as we measure the frequency and intensity of those storms. However, what can be said is that climatologists looking seriously at the global climate change issue do anticipate, based on their data, that tropical storms and the intensity of those will increase, as well as severe weather events, even in places like here in Minnesota.
All right, well, I'm going to talk about infections in particular, but first we need to take another little break. We'll be back right after this message.
Listen up, energy hogs! Get in there and waste some energy!
There's no insulation, boss! It's hog heaven!
Time to tan.
Keep wasting! They'll never know what hit them!
What the?
Boss, they're home! And they've got energy-efficient bulbs! Ah!
You've got the power to get rid of energy hogs. You can add insulation and lots of other things. Get the tips you need at energyhog.org and play fun games, too. Get the energy hogs out of your home.
Hey, wait for me!
Welcome back. We're talking about climate change and its effect on public health with Matt Commers from the School of Public Health at the University of Minnesota. Matt, in the time that we have in this last segment, I want to make sure that we talk about sort of infectious diseases, food, and then some of the mental health impacts of all of this. So kind of take those maybe in that order or whatever order you'd like. What's happening with food supply, with infectious disease, and what impact it has on mental health?
Well, in terms of infectious disease, we know that as the climate warms, disease vectors will have new ranges. So for instance, mosquitoes, which are the primary vector for the transmission of malaria, have been able to spread into new areas in southern Europe as a result of the warming. This is then exposing populations which have not previously been exposed to malaria to the malaria parasite. Malaria being the world's #1 killer, it's a very important public health issue from that standpoint. Here in the United States, we've of course seen the spread of West Nile virus and through into Minnesota, in fact, which is a disease that did not exist here when I was a child. We do expect that with the continuing change in the climate, we will be seeing continual changes in the range of infectious disease vectors. So that will be a major issue. In terms of food supply, I think it's important to go back to the example on rice, that we consider, and this is one of the very important things in terms of our public health thinking about climate change, we need to think in a multi-causal way, in a holistic systems way, about our relationship to the total ecology and how dependent we are on the earth for our continued survival and health. One of the ways in which climate change may impact our health is simply in the way that it impacts our ability to produce large quantities of food. At this time, the world is actually producing more food per capita than it did in the 1970s, when there were many people predicting that we would not have enough food for everybody by the beginning of this century. However, that does not necessarily mean that this is a sustainable increase. We have depleted a great deal of topsoil and have, in some ways, undermined our ability to continue to increase our output of food. When you throw on top of that severe weather events, such as what happened in the southeast of the United States last summer, severe drought, we can start to see real problems in our ability to meet our food needs, and that can be part and parcel with the climate changes. Lastly, I think it's very important that we not forget mental health and the potential impact of something like climate change on the mental health of our population. We know that approximately 10% of adults in the United States suffer from major depression at some point in their life, as well as in the high teens for anxiety. An event like climate change is so seemingly insurmountable and difficult to comprehend that for people who are already predisposed to depression or anxiety, for instance, this can be a source of great exacerbation of those symptoms. As well, it deserves special note, and I discussed this issue with Jonathan Patz, who is a professor at the University of Wisconsin recently, that children are also particularly vulnerable to messages of doom and gloom about our future. So we need to be, as public health professionals, vigilant about that. We need to make sure that we're discussing those aspects of this that are also hopeful, because there are many reasons for hope as well. And I think certainly we need to avoid the kind of historical hubris that every generation seems to have in regards to its major challenges. We need to look back over history and understand that all generations have faced challenges that they felt were potentially insurmountable, and yet we're still here today.
Yeah. Well, recently I reread Steinbeck's Grapes of Wrath, and they talked about the Dust Bowl, and it raises one of the issues. There was a huge migration of people at that point in time, and I suspect after Katrina, a lot of people left New Orleans and Louisiana, went to Texas and went to other places. Are the people thinking about this, thinking about those massive population changes and the impact that'll have on health?
Well, I think that you're getting at the very last area that I think is important to talk about in the relationship between climate change and health, and that is indeed that in order to maintain health at the populational level, people need access to a safe, stable environment. And when you remove that factor, we see health challenged on all sides. So as we see flooding, which is anticipated to occur along many coastlines in the world due to rising sea levels, or as we see larger or more frequent storms, we may be confronted by larger mass migration activity across the world as a result of climate change. This brings a myriad of potential health problems to people, and certainly that will have to be part of our planning. How to deal with situations where a given environment literally becomes, for a given time, unlivable.
So who's dealing with this problem? You know, it's a relatively new phenomenon. It's really not snuck up on us, but all of a sudden confronted us with not a lot of planning. Who's working on this whole issue of climate change and its effect on human health?
Well, I certainly think that it deserves to be noted that the United Nations, in forming the International Panel on Climate Change, and then of course all of the thousands of scientists who participated on the International Panel and were given the Nobel Prize this year as a result, they should be given significant credit for their work in this area. We have a number of distinguished people working right here in the Midwest. I mentioned Dr. Jonathan Patz at the University of Wisconsin. We, of course, are also very privileged to have Dr. Dave Tillman at the St. Paul campus here, who is an extraordinary world expert on climate change and its impact on ecology. We also have Elizabeth Wilson working at the Humphrey Institute right here on the policy acceptability and safety of carbon sequestration and storage, the process of actually taking carbon out of the atmosphere and storing it. What are the safety issues involved with that, etc. So right in our midst, there are many people working on issues to link the science with health outcomes and to address them in terms of both the two major strategies being mitigation, that is actually correcting the climate problem, and adaptation, helping us to live with the effects of climate change.
Well, Matt, this has been really informative. I'm going to have you come back and get into a little more detail on some of these topics, because they're certainly going to be huge factors of what we deal with in public health. Thanks for being with us. I'll be back with a closing comment right after this message.
Most Americans don't realize that their household energy use produces twice as much pollution as the family car, or that America emits more than 25% of the world's greenhouse gases. But it's easier now than ever before to reduce energy waste at home and make the air a little cleaner. You might even save some money. Call this toll-free number for simple steps to make your home more energy efficient. It's easy when you know how.
The Centers for Disease Control and Prevention, or CDC, has noted that the planet's climate is changing, and these changes are likely to affect human health. In response to that, the CDC has listed some steps that individuals, families, and communities can take to prepare for these changes. 4 specific recommendations deserve special attention because they are things that we can actually do. These are: 1. Eat differently. Prepackaged